What's up, you guys? My name is Miguel, giving you the daily dose of radiation, and today we'll be covering the perspective of being a year and a half out of being the tech, and on students. So, I work night shift, trauma 3 hospital, decent size, about 30 ER beds, 35, 2 trauma beds. And that is kind of where I work at. And being with students, we don't really work a lot with students unless they're on their trauma rotation, which only happens for a few months out of the year, and it's mainly with the first batch students and a little bit in the morning between the 7 to 8 a.m. because I work 8 to 8. So really don't deal a lot with students, but I will say now, being in my position and getting a unique perspective, I feel like it's interesting because you know, especially being this fresh out of school, they'll ask you questions, and I feel like when I was a student, there was certain texts that would kind of like, you almost feel like they gatekeeping information, or they wouldn't want to help you, or it'd be kind of a burden. Oh my god! Now being a tech, and I'm if you ask me and we be vibing, I'll give you everything. I'll tell you how it is, give you the cheat codes, make your life better. Cause I'm like, ain't nothing will make me happy that if I work with you, you already know what the business is. Like, you're a good tech, and like I feel like I know obviously every student's different and their learning capabilities are different, because certain ones are like, I know everything, you have to show me, and other ones are more willing to learn, and other ones kind of slower or not as fast, which with time, and because where we work at, certain students don't go through that facility, so they don't know, like they'll just be there for 2 weeks and then try to get a gasp on everything. But I feel like it is important as a tech to help them out, see what they could be improved on, and do it in a friendly gesture. Because I remember as a student, when I did my trauma, the night tech, once again, they were just kind of like, oh, okay, there's this, go do it, come get us if you need help, kind of type vibes, which I guess is nice. You have kind of independence, but at the same time, you're just like, well, hope nothing goes wrong. And I feel like I personally wouldn't allow that, because I remember as a student, you get a little bit nervous, and once again, sometimes the machines be tweaking up, or you shoot it, you like, something will go wrong, and it's better, if you have the tech there, to be like, okay, this is how we do it, or before you expose the patient, oh, we can tweak this, we can tweak that, and we'll give you a unique perspective on that. So I feel that is important. And you're gauging on the capability of like how traumas work. That's another big thing, because I remember as a student, a trauma would come in and the techs would kind of be like, all right, good luck, go do it. And I'd be like, well, there's like 15 nurses up in here, doctors yelling everything, and you're just like, oh like you're just like tweaking, and you're just getting nervous. You're like, oh, I hope I don't clip it, hope, like, you're getting nervous, and like we kind of throw you in the water type deal. And I mean, I felt like whenever we have those kind of serious traumas, as we're heading into the room, I'll kind of talk with them. I'll be like, okay, this is kind of what you expect, this is what you kind of do, determining the situation. I'll be like, okay, if it's a chill, like before or as we're heading there, or if they're doing stuff and we're just waiting our turn, I'll just kind of be like, okay, if this is a chill trauma, not as crazy, y'all can do it. But if it's like some life or death situation, and your tech students are a little bit more slow and not as fast, because you can gauge the vibe. Like when it's a level 1 and like everything's hitting the fan, and you like they need everything fast, and make sure you don't clip it because this man got to go to the OR. You'll just be kind of look at the students like, all right, like we're gonna do it. You can look, and if you can help us, but we're gonna kind of take over because this is like, you know, life and death. Like you gotta, you know, like, you know, you kind of have to be serious in these moments to get everything done, because you know that one shot, sometimes that's all you get. And you know, as students, sometimes you like you get nervous and you don't place the board right and stuff like that, and that can, you know, ultimately determine someone's life. So you kind of had the vibe, I feel there, of the engagement of that. Let's see what else. And I feel like as a student, when I was a student, I didn't get many, like I just learned how to do, like I learned the basic positioning and how the machine worked, but besides that, not a lot of like tricks or a lot of things that improve my efficiency or how to be a more productive tech. Like it was just kind of like, I guess they didn't feel the burden to do it. I'm like, okay, I'll teach you how to do it and you know how to do it. It's good. Now this is how we can improve so you can be a better tech and you can be more efficient. I am all about that because that provides value. That will make you amongst the potential workers or other coworkers later on when you like that. I feel like is not discussed at all at school. Like I've been talking to some of the other techs who are teachers, and I'm like, we don't ever talk about that because I guess you're so focused on trying to actually learn how to do it. You're not, even towards the end of the career of the program, they don't really emphasize. I'm like, okay, try to do this, try to do that. Give the cheat codes, as I call it, of the field to work, increase production, or, you know, stuff like that. And I feel like that's kind of an important thing to do, which I am all for it. And towards the end of the rotation of each student, I'll kind of sit with them and I'll kind of, you know, talk depending on how we vibe and click, and I'll ask them, like, has the information I've given them, has any other tech has done that? And most of the time they're like, no, Miguel, you're the first one to show me this, and this helps so much, and like it improves my stuff, which I'll do another video showing on some of the stuff I do at my place. And hopefully those who are students or those who are also techs can implement those stuff in their careers and make stuff better. What else? I feel like when I was a student, like the techs were kind of, they didn't talk that much, which I mean, I'm kind of antisocial, so I don't talk either, but I understand they're nervous, they got other stuff to do, you know, they're kind of, you know, like I understand because I'm so recently out, and I feel like some of the older techs, you kind of forget about that stuff, and you just kind of brush them off, and you don't do your part sometimes, I've noticed. Or and this is gonna be so mean, but some techs will kind of get back at students because when they were students, the techs they were, you know, learning with were kind of mean to them. It's like they kind of, you know, like, oh, well, now it's my turn to teach them, you know, which is kind of messed up. I would never do that. So, and then try to teach them the difference. I've noticed the difference between night and day, because majority of their little bit of experience they have is, you know, strictly working day shift, and you can kind of give them a unique perspective of, okay, if you work night shift, this is how stuff are done, this is what you can expect. Which, once again, when I was a student at the same college that these students, like, I felt like they never kind of emphasized that. Because it's a big difference on how stuff works that most students don't kind of gasp until they're actually there. And some of them, because certain stuff doesn't happen, they don't get to see and experience. Like, majority of the quote unquote good traumas happen after midnight majority of the times, and the students are gone. Ours are gone by 10:30, so they rarely get to see good dramas. So I wish, because the nurses in our programs here locally, they do overnight, or I would wish that they would just come in and stay a little bit later. But I guess I understand that they don't want to have liability of student leaving in the middle of the night, having accidents, having a bunch of issues, and depending on the workload. Because the way the program is structured, they want the next day the student to be like, I'm fucking passing out, and you know. But feels important being in my shoes doing that, and we'll cut it short.